Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We are here.
Yeah, excited.
We're still really excited. I know we're like, I don't know, we're like many episodes into the season 2, but we're still very excited about our new environment.
Can you check us
that
out?
We're living in. We're getting like official.
I can't wait to start using this. It's a lovely display, but we do these, bring people in from other sites and other locations.
That's
virtually.
Gonna be fun.
Yeah, be like CNN. Fun. Can't wait.
Are we going to do before and afters on that too?
Yeah, we can do that too.
We can.
Yeah.
We could talk. We could. It makes me like a football. How like you break down a play. Dr. Weiler can get like a thing and be like, "This is where we're doing it,"
or like just have a picture of a breast and show exactly where.
Yeah.
Also, like if we need patients, like if we need like a mommy makeover patient, I was thinking about this the other day. If we need a mommy makeover patient that we can talk about that experience, I'm more than welcome to like volunteers tribute.
So you'll
to get a mommy maker.
Okay.
We can do it on live. Like I'm totally okay
Film
with that.
everything
That's
and
it.
then
Absolutely. And
I like it.
Also, like you could throw me up there, do like the football drawing. Like you see.
Goodness.
There was too much skin here. We just remove.
And anonymous people call in, like we just talked about labiaplasties today. People aren't so comfortable with
I know.
doing that, but having anonymous people,
I think it's eye-opening for our viewers to hear patient experiences, right? And I think the other thing is that you always think like I'm the only person that has this problem, right? And then all of a sudden. You realize, and maybe things have changed because I grew up before the internet, but maybe things have changed where you can get online and like, oh my goodness, everybody has this. Everybody feels this way.
I don't know how many people are talking about their labia on TikTok, but maybe.
Yeah, but it makes you feel more comfortable in that you're not alone. And so any patients that are listening that want to come and share with us.
I think we would love, DM us.
Are we going mafia style, like changing the voice, like with the black over?
I
mean, we want you live in this amazing studio, but if you want to be anonymous, you can.
Yeah, that'd be fun.
So my son is, he's in high school. He's been reading Frankenstein. And so like he loves the book. It's kind of funny. And so like when you read a book, like you always, think of the voice in your head, right?
Yes.
Talking about like mafia style. So, my Frankenstein voice is like it's like that, right? And he gets so mad at me. He's like, "That's not the way the voice is." The voice
like, in my head, that's exactly how the voice is.
In his head, it's a French accent, because it's set it's set in Europe, but it's like my son is out there and he was like, that's a French accent to Frankenstein. Like Frankenstein does not have a French accent.
You're thinking of like Mel Brooks.
Yes, that's what I grew up with, Frankenstein, the Mel Brooks one. And he looks at me, he gets so mad.
Annoyed. You're so annoying, Dad.
He gets so annoyed at me.
I hate you.
And finally I was like, why am I wrong? He's like, because Frankenstein has a French accent.
Just be like, are you sure about that? Because I'm pretty sure maybe his brain that makes him speak came from Mel Brooks, circa 1960.
Fun fact.
So we could do the secret guest call with
uh-huh.
either a Frankenstein accent or a French accent.
Fun fact, Dr. Weiler and his son do fencing.
Oh, yes.
So you think that he's just low-key on the weekends? He is
day
actually
that I
a
found
fencing
this out.
expert.
I'm gonna have some video.
Can we please?
We may do a whole podcast on fencing.
Just extracurricular activities.
Run some videos.
What are you involved in? Taylor and I
actually
we chase children.
So I have a tournament this weekend.
Do you really?
Yes. I haven't told my son he signed up yet because he's gonna get mad at me. But it's always a little bizarre because it's 13 or above is adult. So
wait, anybody 13 to 40 is in the same
13. Well, okay, so
are you getting dominated by a 13-year-old?
I have last year. No, it wasn't 30. It was a 15-year-old.
It was 15.
He's good. This kid was good.
Okay,
that's
very intimidating though.
For me or for him?
No, for the young kid.
I agree. But they know that. Now, It depends on like the bigger tournaments.
For me or for him?
No.
I feel like the 15-year-old has the advantage. They're more agile.
Yeah, okay. I get that.
They are,
like
but
they
they're not, these are not, so I'm not bashing on fencing, but you don't have like future NFL players fencing, right?
Yeah.
It's typically a little bit of a niche sport.
Excuse
now,
me,
some
it's
of
an
these
Olympic
kids,
sport.
They are. And there is an influence now. It's kind of funny. You go to these national meets, and some of these kids that are like really high ranked are like really good athletes. And then you have like the kind of like the rich mama boys that are playing. I got beat by the rich mama boys.
Yeah, you did.
15, so he got a whooped up on me. So hopefully I don't get beat by a 13-year-old.
We need you operating Monday, so please.
And actually, look,
we
have I take classes and lessons, and so we have a lady. She's a lady, and she is 68. She's a college professor, and she's
so good.
She's pretty good, but I beat her usually. So I do take it easy on her. I feel bad.
I beat her usually.
Usually, I don't, because some of the matches are real short, so it's like can be a little luck. I do not take it easy on my kids or younger kids.
So
I'll beat those little kids, but I do feel bad with the older lady.
He walks out like, okay, still got it, babe.
Got that 13-year-old. He didn't know what was coming.
This tournament I'm going to this weekend, one of my patients showed up. At it. I was so embarrassed because she was there to see her grandson.
Wait, I love the embarrassment.
And she looked in and she was like, Dr. Weiler, like, what are you doing here? And I'm like, oh. So
not
here with my son. Here with my
operate.
son. Yeah,
and then
right.
next thing you know, I'm beating a sword on a 13-year-old.
Where, like, is this like in Louis? Is this tournament?
Oh yeah, no. There's one here in Baton Rouge, and they have tournaments in New Orleans, Lafayette, and then there's a large tournament once a year, big national tournament in New Orleans. And so yeah, it's not obviously it's an East and West Coast sport. It's a lot of people.
I like in my head, I'm like, Taylor, we're getting fat heads, and we're going to these tournaments. We are going to these tournaments.
That's why I don't tell you.
I was about to say he would die.
Okay, don't act like I can't Google it. Like there's a million fencing tournaments happening in South Louisiana at this time. Like we're going.
I'm going to Dallas this weekend.
That's lies.
All
right. So
today we are talking topic next generation breast implants. Yes. Meghan Trainor's a fan.
Do you know who Meghan Trainor is?
I do.
You do? Okay. All right.
She sings that song. It's all about the bass.
I'm very impressed you knew that. I didn't know that.
Yeah, all about the bass.
Really?
Okay.
You didn't know that?
No.
Yeah, it's all about. And isn't she?
No trouble.
Is she the daughter of the Saturday Night Live dude that is in all of?
Absolutely not. You're talking about the other girl.
Okay. Yeah, I'm talking about.
Yeah. Rob. No.
Rob Schneider.
Rob Schneider. Yeah. No, that's not. It's Ellie.
Somebody else.
No.
Gary Trainor.
No. Gary Trainor's Meghan Trainor's dad, but Rob Schneider's daughter is the one who sings.
Who's Google Rob Schneider's daughter?
Yeah, her name is Elle or Ellie or something with an E. Yeah. Something with an E.
Y'all are over my head.
Elle King. Ellie King.
All right, that's Rob Schneider's
She
daughter.
sings.
Similar voice, though.
Similar voice. Very. Okay. But Meghan Trainor, too, love. Okay, right now I'm really loving Meghan Trainor because she not only the breast implants, so we're talking about, the Motiva stuff today, but she's a huge, huge advocate for GLP-1s.
Oh, is she?
Absolutely.
Yeah.
Yeah, she lost that weight. She's like, I did it with GLP-1s.
Her, Kelly Clarkson.
Yeah.
Different ladies, right? They've always struggled with their weight.
Yeah.
Beautiful voices, right? Sing their faces off, is what my wife would say. And that's what she says, sing their faces off.
So before we get into Motiva specifically, I want you to give us I know we kind of talked about this a while back, but your backstory on implants.
Sure. So
the evolution.
We've got
west of it.
Our special guest today is going to be Dr. Gear, one of our favorites, and she's going to be coming in, and it's one of my partners in my practice. And so, I'll give you my quick perspective. So been in practice for almost 17 years, right? And so when I first started, silicone was off the market. It was just being brought back. Silicone was never off the market for breast reconstruction, okay? And so I was back in 08, 09, and silicone was just coming back. So we were switching from a saline implant, which is a silicone bag filled with salt water, expected to last, give or take 5 years, around 15 years. We were switching to a silicone implant. And that transition was great because saline is I call it a non-compressible bag. It's sort of firm. It moves around in the body, but you squeeze the breast and it displaces. So that's why it feels soft. Silicone was giving us the opportunity to be a softer natural breast. And there was a lot, at that point, there was a lot of concern or teeth gnashing about silicone, right? Because silicone was back. And the reason silicone was brought off the market was because the way the implants were made, not because of silicone. So I always stress to patients, silicone is not a bad substance. Silicone is in everything we eat, touch, and breathe. If you live in a major city, you are drinking silicone because it put it in our water to lube the pipes. If you eat food that has been from a supermarket, look at the back of your product information. All our spices, a lot of our stuff contains silicone.
Right.
If you have had a hip knee replacement, you have silicone in your body in those hips and knees. If you've had an IV, if you have there's a lot. So silicone became a nasty word in the 80s, 90s, and 2000s. And then we sort of revived silicone in the late 2009. And so we were doing silicone implants, and there was, we started with a smooth regular, and then we moved into what we call a textured, and we have to put little pictures up there. We'll put them on the podcast, on the video casts. We moved into a gummy bear, implant.
More cohesive.
A more cohesive implant. And we'll get Dr. Gearin here and talk about this. And so it was called the Style 410. It was shaped like a teardrop, and it had a textured surface. We thought that was the bee's knees and it was the best new thing. And then we slowly realized that the heavy texturing on those 410s or the texturing on our silicone implants was not as good as we thought. There were some later issues like double capsules, we call them. And, there was a very, very, very rare form of cancer that could occur because of that texturing. And so we then switched and went away from a smooth or a textured and just purely to a smooth implant. Now, there's been, depending on the company that you talk to, there's probably been 2 or 3 generations of silicone implants since they were reintroduced in 09, 08 time. There were 2 major companies in the United States, Allergan and Mentor, that dominated the silicone breast implant market. So to give you statistics, I love some statistics, right?
I like a number.
All right. So currently, and these are 2023, so we are using primarily silicone breast implants these days. Saline makes up less than 2% of implants worldwide.
Wow.
Less than 1% in the United States. Okay. They did 1.9 million breast augmentations worldwide. The average, 90% of ladies are between the ages of 19 and early 50s. Okay. The breast implant number of augmentations has risen 17% since 2008. So it is still a very popular. It is growing still. Okay. U.S. dominates in terms of the world and how many breast augmentations are done. The U.S. last year was roughly, let's say, 275,000 roughly done in the U.S. Brazil is number 2, right?
Wow.
At 250,000. Wow. So, U.S. women, and I want to talk about this real quick. And then who do you think number 3 is? U.S., Brazil. Take a wild guess.
I want to be like Europe, but I'm like more specific.
Europe?
No. Okay, I was going to say Europe.
Mexico.
Mexico.
Really?
Isn't that crazy? Mexico. Yeah. A lot of breast augmentations in Mexico.
Get it.
Number 4 is Argentina. Huh. And number 5, who said Europe, is going back to Germany.
Oh, okay.
So, it's kind of my running joke, like U.S. women and men especially are obsessed with breasts, right? We're a breast-centered society. Brazil is a buttock society, but they also like nice breasts, not as big. And I always say breast augmentations in the United States are very regional. What I mean by that is I tell my patients that the East Coast average size is around 275 to 300. SEC is around 400 to 425. You start moving into
West
Texas,
Coast.
California,
I just
you're
love
talking
that
550.
it's a football. Like it's literally
It's a football.
It's the conference.
It is.
We're like, there it is. That
it is.
demographic.
It's interesting. So now the thing we're going to talk about today is Motiva breast implants. So there
this
has
is the new bee's knees.
It's the new bee's knees, and so the reason is there has not been a new breast implant company that's been successful in the United States for the last 15 to 20 years. Okay.
Okay, so Motiva has been in the United States for how long?
They were introduced, let's say, at the new year, roughly.
Okay,
available.
but they've been available.
They've been in Costa Rica, so South America, Costa Rica, Australia, and somewhat in Europe for over 10 years.
Yes. Okay.
So it is a 10-year-old company. And
they finally got FDA approval here.
And they are turning the breast implant world, in my opinion, upside down. And we're going to talk about that when we bring Dr. Gear
Yeah.
in.
I bet everybody's like, whoa,
Yeah.
God.
And
what is this?
I am going to
He
talk
just
about,
went to the big headquarters.
No, I didn't go to. I
Okay.
didn't go to Costa Rica. I went to a big
Denver.
another surgeon where they do a big teaching and they bring you into their practice and talk about their. This was a guy that did the original investigations to get it FDA approved, and why he has just gone all in, all in, and it's pretty amazing. So and I think it's a wonderful thing. So let's take a little break. Because this is really, I want to discuss this with Misty, and take a little break. So we're going to thank our sponsors. All right. So we want to thank Weiler Plastic Surgery Group, the largest aesthetic cosmetic plastic surgeons group in the state of Louisiana. We got 5 board certified plastic surgeons. We've got over 12 injectors. We cover the entire southern portion of Louisiana. We also want to thank Rejuvime Medical, the largest anti-aging organization clinic in the state of Louisiana. Rejuvime specializes in GLP-1s, which is weight loss. They specialize in hormone optimization, testosterone replacement, and they also do aesthetic injectables. So stay tuned. We'll be right back.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
Hey everyone, welcome back. We have got our expert surgeon with us, Dr. Gear. Tell us a little bit about yourself.
Yeah, so Dr. Mary Gear, Misty's a lifelong nickname. You hear that sometimes. Mother of 7 or 5, depending on if you count stepchildren. Born and raised Baton Rouge. Been with Weiler Plastic Surgery Group a little over a year now.
How long have you been practicing in Baton Rouge?
7 years, I believe. I opened my practice in 2018, and then if you can't beat them, join them. About a year and change ago.
Glad she joined the practice. So good.
No, it's been awesome. And I think you bring a different perspective as a female and as a, not that I'm an immigrant here, I'm but as a lifelong Baton Rouge resident.
60 miles make a big difference.
It does.
Yeah.
It's
like 2 islands.
It really is. It really, couldn't be more worlds apart, right? But no, and I think it brings a different perspective. And I think you and I having this conversation about Motiva implants is a great topic, because obviously I'm not a female. I mean, I'm married and I do a lot of female patients, but you are a female, and I think we have a little bit of a different perspective on it, and we both been in practice a significant amount of time, and so I think our minds and our practices evolve, right?
Yeah, and just to talk about implants, I grew up in a house where I played frisbee with breast implants.
So your dad was
my dad pioneered breast surgery in general and was teaching plastic surgeons how to do breast augs. His practice was primarily breast cancer based, but back in the day, you did a little bit of both, a little bit of everything. So he kind of fell out of love with implants when there was so much litigation and issue, and he didn't have to do that anymore. But so I've been around breast implants and women
your whole life.
Yeah, well, women the whole life, but women with breast surgery. I mean, it's.
That's funny. My daughter.
It's pretty amazing.
And my kids, when they're little, they stuff it in their stomach for, oh look, I'm fat, put a breast implant in there. And
I remember them having a war down the hall in Hammond, throwing them at each other.
I always wanted to put them in a pillowcase and have a pillowcase made out of breast implant.
That's hilarious.
You had the same experience.
It's my breast implant pillow. Right there. That's absolutely hilarious that you're having a war, which just shows how durable breast implants can be. Your kids can have a war with them in a hallway, and they're going to remain intact. Well, cool. So we're getting into Motiva today, obviously, and Dr. Gear, this is something that that you are very familiar with.
Yeah, I think when you talk about breast implants, we kind of feel like we're opening a can of worms. So I was hesitant to not try, but hesitant to get too excited about anything in the implant world, because there's so much misinformation. We don't control the narrative of our breast implants anymore. Most information comes from people on social media, from bloggers without medical training.
And so, even those with medical training can be some bad players out there.
Oh, sure. There's just a lot of where there's smoke, there's fire is the attitude, and not a lot of... Anyway, beside the point. So when Motiva came out, it was kind of like, oh boy, here we go. Like,
another one.
What's the same way? Another one.
Another one.
But there is a pretty tight network of female plastic surgeons, and enough of them that I trusted were pioneering or a part of the initial year trial from the FDA here in the States. And across the board, they all gave them a thumbs up. So I said, as soon as we can get them, let's get them so we can see what the buzz is about.
Yeah, I was sort of the same way. So I don't have access to that tight knit female group, but I was excited, but like you, or another going to be disappointed and all that. And then the company actually invited me out, and I spent the day out in Denver at with some surgeons, a surgical group out there, and had an amazing experience. He was one of the original investigators for Motiva back in 2019. And as soon as they were introduced and approved, which was a few months ago, he switched, and his entire group has now switched. A group of 5, similar to us, has switched to Motiva only for breast implants, and they feel so strongly about that.
Well, here's the deal. They're different.
They are definitely different.
Well, that's what I was about to say.
I thought to myself,
how
much different can a silicone breast implant?
That's what my question.
Yeah, what makes it different?
Show me, prove to me that they're different. And they look and feel different, but they perform differently.
Right.
And it's pretty dramatic.
How is a breast implant performing?
No.
So the big thing that I guess confuses me, and you see it with your patients, is that it mimics the natural breast, is what majority of people are saying, is that it just kind of moves with the breast and looks like this.
So there are as of now in the United States, 2 main implant types with Motiva. You're talking about the ergonomics, and that's with an X. So these are both 6th generation, what they call viscoelastic silicone gels, and they're different in the 2 implant types. So in the ergonomics, that is the one that is designed to really mimic the look and feel of breast tissue and to move with the breast and perform like a breast. And it does. But even with that type, both implants styles, the other one being the round style, and they have different gels. So the ergonomics has the Progressive Ultima, or I may not be saying that. The other one is the Progressive Plus. They're patented different gels, but they both are 100% filled, which I believe is a difference from other implant companies. And they retain their shape, and particularly that upper pole fullness, better than other implants.
Yeah, and I think so I do think with the other implants out there, you could get a very natural feeling breast. I think in my simple mind, so I've been in practice for a long time, is I believe this implant has allowed us, and we'll talk about this, to shift from below the muscle primarily to what we call either subfascial or subglandular, which is above the muscle but below the breast. And so the reason we were putting implants below the muscle, a lot of it had to do with the implants themselves. So the other implant companies are not 100% filled. So these are 100% filled, which means the rippling is much less.
Right.
You may be able to feel the implant, but you'll never see the rippling. And so the reason we put them below the muscle is because it gives us an extra layer of coverage at that upper pole for those implants. Smooth implants also shift and turn in the body they're smooth, so they roll around in the body, and so we can get
not in the body, in the breast
Like,
pocket.
yeah.
I'm sorry, in the breast. Okay,
Don't
in the
worry
breast
about
pocket.
my breast implant on my stomach. I'm just gonna like pick it
In
right
the breast
back
pocket.
up.
I apologize.
Hey,
I
I've
need to be
fixed
more
that before.
specific.
It's like oopsies.
So,
like
but-
put that back.
But no, the smooths are made to they're soft because they can move, they displace, they move in that breast pocket. That's a good and a bad. It's a bad because they can flip back upside down or backside forward. And then when you're under the muscle, there's also that muscle is forcing that implant down and laterally in most people.
Because that's the contraction of the muscle.
Correct.
Yeah.
And then the other issue we've always battled, it's gotten a whole lot better in breast implants, but we've always battled firmness or capsular contracture in the implants, and we've always battled rupture of these breast implants. Now, all those things have gotten way better. So, if you got a breast augmentation in 1980, the risk of firmness around your breast implant was pretty high, right? 20, 30, 40% back in the day.
Yeah, well, and for several reasons.
In the 80s.
We weren't, now we have sort of this shelf life with implants.
Correct.
We encourage women to change them based on the implant, every 10 to 15 years. And I see patients all the time still that have implants for 30, 40 plus years and said, no one ever told me
Right.
I have to change my implants. I think anyone who has breast implants, especially silicone breast implants that old, has some degree
Of a
of
contraction.
capsular contraction.
Yes.
And
Totally
explain what that is. What
Yeah.
is a capsular contraction?
Right. So your body makes a little layer of tissue between you and the implant. What I tell my patients is it's your body's way of saying, hey, like I can tell you're not really supposed to be here, but you're also not causing me any issues. I'm just going to create a little layer between me and you, and we coexist. That's the same if you have a foreign body for any other reason. If you have a pacemaker, your body makes a little rind around the pacemaker. If you have a knee replacement, hip replacement, it's just a normal response to a foreign body.
Like a fence between you and your neighbor.
But it is varied. And to this date, we don't totally understand why some women have a robust response, sometimes, almost instantly, and why some women can go their whole life and never have any real degree of capsular contracture. So it's patient specific and
And to be, for our viewers, so we do want that layer to form because it does hold the implant in place, right? And so you put your knee or your hip implant in there. You do want that little
Or
bit
your
of
nip
scar.
implant. Or
Not
your
your
nip.
implant, I know. I was thinking about nipples.
that's a different podcast.
But you do want that scar, that tissue to hold it in place. So, but we want to control that tissue because we want it to hold that implant in the proper position, but we don't want too much of that inflammatory response to make it firm.
Yeah.
Right?
And my understanding was really the main reason, and primarily in the United States, because it wasn't necessarily the same in Europe, because we had some differences in our CapCon data. The main reason the pendulum really swung to submuscular implants was because of the CapCon rate.
Yes.
Wait, with Motiva specifically?
No,
or
no,
just
just
subglandular?
implants in
Yeah.
general. So
Okay.
that's how we kind of got to most plastic surgeons that have been trained in the last 20 years. Most of them were doing
Subglandular.
submuscular
Muscular.
Okay, got it.
breast dogs
right.
because of the fear of CapCon.
Right.
And I had a little bias from the get-go because of my dad and then my brother, who was a plastic surgeon as well. Having had, they were both kind of like, I don't really think that pans out in the end, and that pre-pec recon really still has a place, or not recon, pre-pec implants, recon or aesthetic breast implants. Because that's where the breast is supposed to be. Your breast is supposed to be soft, mobile, squishy thing above the muscles. And I was seeing so many women who have implant to breast tissue disharmony. And, no matter what you do, if you put the implant above or below the muscle, it holds the implant there better. So if you have any breast tissue of your own, eventually it tends to slide off of the implant. They all, to me, animate a little bit, whether they notice it or not. So what is animation? So when the pec twitches, just doing normal activity, you can see the implant toggle a little bit. And then, like you were saying, the natural motion of the pec is going to push the implants down and out. It doesn't matter, time and gravity, and 99% of people is only going to take implants one way, and that's down and out. So I was so tired of seeing that, I wanted a better option.
Yeah. And the benefits, go ahead.
No, I'm just like, what am I talking?
Right.
Well, there's a downside too, right?
Right.
So
Yeah, there always. It just can't be perfect.
the traditional thinking was that you needed to have really good quality skin. The breast parenchyma, so the tissue, the gland itself, needed to be in relatively good shape too, because we do see women who we call it gland failure, which is probably not the best terminology, but just the tissue has been so stressed, whether it was pregnancy, weight loss, whatever. It's just
nursing. Yeah. Oh yeah.
Just doesn't have any quality to it.
Yeah.
So those are women that you can't put an implant just below that tissue and expect it to do what you want it to do. So, but what Motiva has allowed us is to expand who meets criteria for above the muscle augmentation.
I love that.
And I think the reason why, so to kind of go through in my mind why it's different. So one, I believe it is, and statistically, a safer implant, right? And so, the CapCon, the capsular contracture rate of these implants is, we think, and the company is telling us, less than 0.5%. And so that's what we were talking about with the firmness of a breast implant.
What's the
average? Normal.
Yeah, like what's the average prior to this coming out? What was the average?
All right, so if you talk about 80s, super high, like Dr. Gira said, right? We knew we were doing things, and we knew the implants were designed improperly. Recently, in the hands of a really good surgeon, I'd say give or take a little bit, 4%, 3%. Would you agree with that, Misty?
I think that's probably reasonable.
Yeah.
You love numbers. I hate numbers for this very reason, because I can't believe I'm going to quote my mother-in-law, but it's like the figures don't lie, but the liars sure can figure.
Yep.
So I have an inherent sort of distrust of just numbers.
I agree.
And nothing beats personal experience, right? So you're going to trust what you see.
Yep.
But I think that's probably pretty reasonable.
Yeah. I think it's
under 10% for sure.
I think it's still a problem in a busy plastic surgeon's practice. It's still an issue somewhat, right? The capsular, because you do have some patients that randomly get it, and then you do have people that I call them almost like an implant cripple.
And why is it always one breast? That's what drives me crazy. It's like you got the same exact, as far as we can tell, variables
and just
control
one
for.
side.
Yeah,
and one side's just like
yeah. It's just, and so that's a problem we battle with our patients. So that's one. Number two, number one, their rate is much lower, we think. Number two, we talk about rupture, and that's what everybody fears, right? Implant rupture, and that's where, so the silicone has got a lot more cohesive, which is more gelatinous or firmer, and so and our implant rupture rates have gone down significantly, but there's some that believe it's still much higher than it should be. Depending on who you talk to, it could be 5%, could be 1%, it could be 10 to 20%. It's still higher than it should be, right? As a mature plastic surgeon, you do see patients that you've put in. So yesterday I saw a patient, I put in implants 12 years ago, and she had a single-sided rupture 12 years later.
What causes a rupture? Is it just like can it spontaneously happen? Or
was her saline?
No, it was silicone.
It was silicone.
Yeah.
So to be fair, we don't know what the occult rupture rate is.
We don't.
So,
and by occult, she means undetected, right?
Correct.
Or
meaning
silent.
And that's because a lot of patients have no issue with it, and it doesn't cause any clinical issues. But what causes an implant to rupture increases with age. Now I think the jury's still out on Motiva, right? Because they've been around about 14 to 15 years. So we have their numbers from that, but we can't say after 15 years it's more likely to happen. Right. But you can say that about other implants. That's the main reason to change them out about every 15 years is the risk of rupture goes up.
Okay.
And I'm going to disagree just a little bit, but that's okay. I don't typically, I don't disagree with what Dr. Gira says, but it just depends. Every surgery there is a risk, so you have to weigh the replacement risk with the risk of surgery, and so I'll just throw that.
Okay,
because
I'm obviously brain warped because of him, because I've always followed what he said, but I thought that if it wasn't broke, don't fix it, because you're increasing your risk of capsular contracture if you operate again.
Okay, well, it comes down to patients. I'm not saying that there's a magic line in the sand at 15 years, but if you're looking at the implant warranty,
you're recommending
they're going to cover, so like Allergan and the other big implant companies are going to cover rupture within that period.
Yeah. Okay.
Outside of that, they're going to tell you your implants are past their
warranty.
Their shelf life.
Yep.
Right.
I agree.
And that's because we know that the risk of rupture goes up.
Yeah.
Now, certainly, I tell my patients all the time, if you want to come see me once a year for me to check your implants, if you're having zero problems, there's no sense of urgency. But what you don't want to get to is 85 and then have issues, which we do see. And believe it or not, just because you're 85 does not mean you don't want your breast anymore. It just depends on what's going on in life. If you're otherwise reasonably healthy, most women still want to look and feel attractive. So I just encourage my patients to be proactive rather than reactive. But there are definitely patients who essentially say, if it's not broke, don't fix it.
Okay.
And I think it's like Dr. Gare said, every patient's different, especially as you age.
Right.
And there is a statistically, if you have breast implants, you usually do at some point do a procedure in the future, statistically, either to replace, improve, or change the appearance of your chest. So,
is there a warranty difference with Motiva? Speaking of,
there is. I would have to.
Yeah, we'll have to get the reps on
I would have to pull it up.
But do you like
speak specifically? But I think from what I can ascertain is it's better.
It's better.
I think it's like a lifetime warranty on rupture.
Yep.
Wow.
Yeah, they're claiming so.
How cool is that?
Yeah, they're claiming a 0.6, 0.5, 0.7% rupture rate lifetime at this point, which is significantly better. And they're saying that's because the way the implant is made.
But to get back to your original question, why do implants rupture?
Yeah.
I have several theories.
Oh.
Obviously,
Okay.
trauma is one. I mean, we've all seen someone who comes in with like a
Right.
seatbelt injury who had some direct blow to the implant that can do it. Though sometimes I wonder, I mean, you've seen us beat them. I've walked on them. I've hit them. I've rolled over
in
them.
the cars,
and
right?
you,
Yeah.
you just
Children
think to
are
yourself,
using them
We did
in
a video.
war hallways.
how was there that much force to cause? But I think at least a fair amount are iatrogenic from how they were placed before. I think we used to try to make women in the 80s, 90s huge. We were putting big, giant implants in through as small a hole as possible. There was a lot of manipulation and force, and I think there's probably some subtle injury to the shell, and that equals rupture over time. But that's just my.
I can see. I could
that is
definitely
my
see that.
working hypothesis.
Yeah. So is this still inframammary, like still the normal incision in the breast fold with this type of implant, or is it that doesn't matter?
Yeah, so this goes back to the capsular contracture rates so we used to, as plastic surgeons, and this is changing as I was coming in, some patients used to get a incision around the areola of the nipple, right? And so the theory, we went away from that is because we thought that you're disturbing the breast ducts through your breast. There's bacteria we know in those ducts because they're open to the air, and we thought you were getting sort of a subclinical infection that was causing that firmness or that scar tissue. So I would say the majority, and you can disagree or agree, but have gone to a incision in the fold of the breast.
Yeah, that's what I use for a lot of reasons. One, what you're just talking about, I think the consensus is that is the approach associated with the least amount of issues, from infection to capsular contracture. It's the revisionary approach if you have a problem. So in my opinion, why would I put 2 scars on the breast when I could put 1? Most issues and complex breast deformities, et cetera, I think you can control through that approach. So that is what I use the overwhelming majority of the time.
Yeah.
I think also less
very hidden.
Less change of nipple issue sensitivity, right? So we've become more aware of trying to preserve the full sensation of the nipple. And so the IMF incision gives you the best chance of preservation of that. And then, like Dr. Gare said, you can get, if you go through an incision twice around your areola, it can retract and pull, and it causes issues. So majority of surgeons are now.
Are y'all liking Motiva mainly because it is suiting for above the muscle? Is that
so? I don't know, because this has changed my thought. So I do. I love it because it can go above the muscle. Yes, and I love it because of they don't have a smooth surface. They have a smooth silk surface, they call it.
So they have, what do they call it? Like a more biocompatible
It's a 0.4
surface.
micron, I think, surface that is less inflammatory.
the heck does that mean?
It's a very, very small.
It enhances biocompatibility.
Yes.
Reducing the risk of it. Okay.
And in my simple mind, I think it allows the implant a few things. It attaches or holds better. It's not flipping around in the pocket. It's not moving around in the pocket, number one. So you can put it above the muscle. Number two, it's giving you more because of the way it's 100% filled, and the new gel, it gives better upper pole fullness, more volume, and more projection with smaller implants. So we can use a slightly smaller implant, which means less stress on the body, in my opinion. And I think the surface of the implant is revolutionary also, and it's causing lower capsular contracture risks, allows us to place it above the muscle in a more anatomical appropriate position, like Dr. Gear was saying.
Yeah, so I was already leaning hard towards pre-pack in anyone who I could. I think the recovery's faster. Like I said, I think it puts the breast where it's supposed to be.
Dr. Gear's an early adopter.
And there were certain women who really want this crisp, full look. They want their breasts to be well defined. They don't really want them to move all over the place. And those are the women that care less about having a natural breast. They want to look, right? So I think this implant, the two styles, are letting me play with both of those in the pre-pec space.
Without being able to palpate the implant.
Correct. Okay. Now, look, you have to have some breast. You have to have some breast tissue. Or you accept it that you might feel the implant some. But like you said, it doesn't ripple. Like even in these thin atrophic skin patients, it doesn't ripple because of the way the implant is engineered. And you can take an implant, a Motiva implant, that has the same dimensions as its competitor, and it behaves very differently. Just getting it in the implant pocket. We use something called a Keller funnel, or at least I do, to place most of my implants. We try to minimize how much we touch implants because of the thought that there's some degree of contamination or something that might contribute to Capcom. We do all these maneuvers to sterilize the pocket and not touch the implant. But you cannot put a Motiva implant through the same, we have to cut that funnel back and make the aperture a little bigger to get it in because the implant is just different.
Yeah.
It doesn't squeeze.
It doesn't squeeze as much. So and by doing so, when you put it in the pocket, it just fills out that pocket. And what I'm seeing so far is it stays that way.
Wow.
Like these implants they say, I want to say 20% more upper pole retention.
Yes.
It seems like more to me.
Yeah.
At first.
And women come in and they want, so most women, and I think the majority of and we certainly have those young patients that come in that just want big breasts, but I think a lot of our patients have had kids and they just want that. Most women
just
maintain lower pole fullness,
Yeah.
but they don't have the upper pole fullness.
They don't want to roll their breast up like a taco and put it in the bra.
They want the pregnant boobies.
Right.
Correct.
They want that
those
upper pole
pregnant
roundness.
boobies back.
And this implant, because of the way it's designed and built and allowing us to do these things, gives us a lot more upper pole fullness, which most women want, I believe, right?
And what I'm hoping, because you were hinting at this, because of the way the smooth silk shell is, I'm hoping that translates to some degree to the less movement of the breast tissue on top of the implant.
And I think it will.
So less sag?
Yeah.
Well,
Over
maybe.
time?
Maybe. We don't know.
Maybe.
We don't know. But
Jury's
we think
out on that.
Yeah, we think that.
Taylor's like, take mine out.
Please.
Take them.
Replace.
Yeah.
Take 'em.
And look, I don't think I think and the other thing is, and I'm not like talking about this, like, I think it's a good company, great company, but they are the only company that is innovating in the breast implant space. So
There's been some complacency.
They have, yes, and two
other
reasons why.
companies.
Because, and this was eye-opening. How much do you guys think it costs to get a breast implant approved by the FDA?
I was going to say this has to be a challenging space to be in.
Yeah, think about it.
$2 million.
No.
right.
Okay, yeah.
Taylor?
I was going to say 1.5 million.
1.5 million, 2 million,
I'm going to say it's more like $10, $20 million.
10,
Something
100
crazy.
million.
Yeah.
Shut up.
to bring a new breast implant to the
Shut
market.
up.
$100 million.
Do you think that the other companies have become complacent because they're like, nobody's going to do it?
And so, and then, yes, because remember, so Allergan, which was a great company.
$100 million?
$100 million. That's insane.
So the other issue is this company only focuses on breast implants, okay? The other company, which is, I'm not going to name them, but they're owned by large multinational companies. And the majority of revenue these days, and this is a whole different podcast, is pharmaceutical based, which is charging patients $500,000 a year for dermatological medications, you know, or you know, and there's some, but and so they don't focus or care about implants because the companies are too large. They have multi-billion, trillion-dollar revenues, and they're focused on other things. So this is like the little player that came in, got big enough to be able to put the money up, $100 million to walk into the U.S. space. And now since they're here, they're like, game on. We're going to innovate and we're going to change some things.
Wow.
And I think, yeah, exactly. They're sort of like, you know, I don't want to say they're a tech company, but they are an innovator, and they are going to bring. Nothing has changed. I mean, me and Misty have been in practice for, like I said, 2008. they've changed a little bit in the cohesiveness, but nothing else has really changed.
Right.
They've taken things away from us, but nothing has come.
I feel like they're coming in and they're challenging this industry.
Yeah.
Like, okay, this is what we're bringing to the table. What you got?
But they're an innovator. And I think that they are focused on women. They are focused on improving breast implants. They're focused on giving women better outcomes, which no other company is, in my opinion, on this. And that's what makes it, to me, so exciting. And I was sort of like, Misty, when I went to this, they flew me out to Colorado, and I went to the aesthetic meeting. I was a little bit pissed, to be honest. On my way out there, I was a little irritated, and it's a long story.
I think it was Easter weekend, huh?
Yeah,
You're like, what am I doing?
Yeah, I was like, what am I doing? I'd had sort of not the best experience with something with it. And, I was stuck in my old ways. And I went out there to this practice. There was a couple of surgeons out there throughout the country. And it was just a great eye-opening experience. They had some great reps out there. I'm going to try to get them on the podcast here. It was just an eye-opening experience to say, this company is innovating. They are advocating for breast health, women's health. They are statistically showing us that this can be done better, right? Safer. And I'm like, damn. And this is a procedure that, we sit here all day and talk about, it's all about confidence, right? And so
at the end of the
who
day,
doesn't want nice breasts, whether you're a man or a woman, but you know what I'm saying?
Yeah.
And so I think it's awesome. I think it's an awesome thing. I'm going off on my soapbox.
I'm
going to step off my soapbox.
Post-op, walking with breast aug patients, in their post-operative period, that they all come in the first week to 2 weeks with their implants up here because that muscle contracts everything up, and they have to live like that for 6 weeks. And the thought of subglandular and it just being, is it easier recovery, easier everything, huh?
It is. And occasionally, so I tell my patients, no one's the same on both sides.
Yeah.
So you can have some inherent asymmetries in the chest wall. Even implants, when they settle, they may not settle quite the same. And those things are maddening for women.
Yeah.
And they're hard for us to fix because they really look pretty good. And it's like, do I make it better by trying to do more? Do I just tell them to leave it alone?
They're sisters, not twins.
Correct. Everyone's tired of saying that. The whole world says it now. And it's still true that the breasts aren't the same if you're going above the muscle, but you just eliminate all the woes of the muscle. And especially for my yoga teachers and my Pilates people and the people who want to get back to doing a lot of that type of exercise, this is such a better option for them.
Yeah. Your thinner, more active patients, this is game changer for your younger. There's some innovations coming down the road for our younger ladies that don't want that necessarily, like the idea of my mama's breast implants. They're going to be very different in the future. The incisions, the placement of the recovery, the longevity, the safety profiles are changing. So it's awesome, man. I'm excited.
Yeah, I know.
You're ready for
something
new.
Something
it's
new.
Exciting that somebody is challenging the industry. That that it
we've
can
had
be
them,
better.
When did we start? We've had them since like January.
Yeah, but first of the year they kind of slowly brought them out.
And
so a couple
where
months.
are we? We're May.
Yeah,
I'm absolutely getting
You're on
some.
board.
Yeah.
Really?
Oh, you're gonna get some?
Really?
Oh, we can have that to get back on here. Be like, how do you like
That's awesome.
it?
Yeah.
And I've had no issues with my current ones,
Yeah.
but they're approaching that time.
Yeah.
And
Time to change.
Might as well.
Yeah.
And
When
do they
in Rome.
have the same? So our traditional implants come in different profiles or different projections. They have all of that the same. All this. I mean, all that's
The options.
similar.
There are options. I think you can get really hung up in some of the terminology here because every implant manufacturer has their own little verbiage, right? But yes, they come in sort of lower, middle, and higher projections.
Okay.
They're going to call it their full, demi,
And mini.
and mini.
And mini.
There you go.
Very female oriented.
It is. I love that. I love
Good.
Demi.
Yeah, Demi.
Love that.
And
They have the two different cohesiveness of their gel. There are more options coming.
Okay, what's
the
up?
FDA is always hesitant to give us everything. So, there are different sizes and more sizes coming. There is a different cohesiveness coming. There's lots of innovations coming. They were talking about, and then this may seem creepy to some, but, a lot of younger girls get them. So there's actually could be a temperature probe in your implants to know when you're ovulating.
What?
Yeah.
What?
Talk about
Wait a
biohacking.
minute.
Yeah, isn't that crazy?
Wow.
Yeah, so there's a lot. Look, the world's progressing quickly, and this is this isn't the world's greatest company, but it's a great company, and they are solely focused on implants, and they are the only ones innovating right now, which is amazing. So it's a strong argument.
Okay, so I have a question. So your current implant, are yours under the muscle or on?
They're above the muscle.
They're above. And I was just curious because I know that's the thing.
True story. And people may think this is weird. I saw a plastic surgeon in town. My brother happened to know him reasonably well. They were on the interview trail together, and I told him the plan, and he was like, "What are you doing? Don't do that." And he was like, "You should go above the muscle. You won't need a lift. You're going to do fine." My dad had done pre-pack for a bajillion years. He thought they looked and felt better. And my brother did my AUG. After my fourth child.
I was going to say, was this before or after the babies?
I waited till after babies because of that very reason. Like, you have breasts that you can't do anything with.
Right.
It's like demoralizing to go put on a nice dress or a bra or swimsuit, especially after having these awesome jugs after babies,
Right.
That's
I was just like, and my husband was not on board. He didn't really want me to do it. And I'm like, I cannot do this anymore.
Really? Yeah.
And I mean, I'm fortunate that I, wasn't a huge expense for me, and I have family who's a plastic surgeon, but I think most women, as soon as they get their implants, are like, why didn't I do this?
Why didn't I do this earlier?
Yeah, like, why the hell did I not do this before?
Do y'all have any patients that are just like, you're not a candidate for Motiva?
I don't have anyone that I would say is not a candidate for Motiva. Now, if I say they're not a candidate for a implant, period, for some reason, and off the top of my head, I can't think of
the only thing I would add to that we don't have as large of a size in Motiva as some ladies may desire.
Yeah, he might be more adventurous than I am in the implant size world.
What is the biggest implant we've ever put in?
I don't know if I should talk about it.
And I'm like, was she from Texas?
Florida, maybe.
Was it in Mexico?
Okay, just kidding.
Right.
It was legal, but we're not going to talk about it.
Wait,
what?
It was legal.
It's like a wild night. It's like a
Come on. My gosh.
That's why I ask my patients, like, what are your goals here? My goal for you is to give you as full a look as I can with you still looking like a reasonable human being. What's reasonable to me may not be reasonable to some people, but your friends and family that see you on the regular might know something happened, but the stranger walking by isn't going to look at you and say, hey, look at the woman with the breast aug. And I was like, if you secretly want to be like porn star or pole dancer big, you got to let me know, because that's not my vibe, and I might refer you to Dr. Weiler.
No, and he is not known for that.
I don't. And look, I
give him your spiel about what you tell patients.
And we're both. I have a little bit of a different spiel. Is that my goal is to make patients happy, and if they want. So to answer your question, so 800 cc is currently available, a little over, and then Mentor came out with 1,000, and then you can overfill saline implants a little bit larger. So I tell patients, I will discuss the risks of larger implants with patients, but if they're a candidate and feel like they can comfortable and they're mentally aware, I am happy to do larger implants on patients. So,
but it's not like what he likes, and I think he makes that known to the patient. That's not so much what I would pick for you.
I always tell patients is, don't ask me my opinion unless you want it.
Right.
Because I have different opinions than what patients want. So
I was just sitting here thinking of 1,000. Okay, 1,000.
That's a big one.
Okay. We would, like, in ICU. Okay, here's a liter. That.
But look, 1,000 in some women is nothing.
Yeah.
I know.
It's all about the chest and the breast, and in the recon world, that's where it gets challenging. That's where I've done the biggest implants, is overfilling saline implants, getting 1,000, 1,100 in there.
The taller people.
Yeah, like there are 15. I think Motiva has a very large implant, like 1,400 cc's out there in Australia. So
it's like the size of my head.
You are one of those smaller head people, so you're probably bigger than your head. The size of my head, I have a gigantic head. I'm the custom hat guy.
We should get one of those just for
just right here.
They were actually telling me when we went to the thing, Motiva made, I think it was a 5,000 cc implant just to prove their technology. It's at their headquarters.
So I think
when you walk in, it's like a giant, it's like the size of a baby.
If you're listening, Motiva, I think you should make little bitty implants that are like little bitty stress balls, and we put them in our little patient gift bags or like a pre-procedure.
So good.
They're gonna call you up and fly down to Costa Rica if they hear this podcast.
Go. Let's go. I was going to say Costa Rica.
And I want to add to her question. I wouldn't say that you would say they're not, but you may need to combine it with a mastopexy, which she does a lot of.
Yes.
Like you're not a strictly an implant patient, but you need a lift with an aug.
I think we usually find a solution for most people.
Right. And you can do a lift with a
Motiva.
subglandular implant above the muscle.
So I think this is a whole other conversation, but I think a lot of that depends, kind of like we talked about earlier, on where you trained and who you trained with and how you orient your pedicle, which is the blood supply and breast lifts. And so almost all of my lifts, reductions, I was well versed in a superior medial pedicle. So that lends itself pretty nicely to a lift in with a pre-pack implant.
Yeah.
Love it.
Yeah, the world is changing quickly.
Wow, it's amazing.
I know, it's so wild. Everything.
It's kind of shaking up plastic surgery, which it hasn't been shooken up in a long time.
Let me tell you something. At the meeting, there were some haters on both sides. So it's a hot topic. I probably was, one of maybe the haters, and now I'm like fanboy. Which is weird.
It is weird.
Fanboy.
Well, I love that. Does anybody else have any questions before we head out of here? Did we cover everything?
Look, we're definitely gonna expand on this topic. We're gonna bring back some patients as our experience grows as a group. We're gonna talk about it more.
This is new.
We're gonna talk about lifts. This is a brand new sort of this is a new exploding topic. They're going to innovate. We're going to talk about their innovations as they come, and I'm excited. I really am.
Yeah, I think patients are excited.
Oh yeah,
and they're hearing about it.
Yep. I was going to say, are patients asking?
Oh yeah.
Oh,
and I made a silly reel about round versus ergonomics, and I've had several patients be like, I saw your reel.
Yeah.
I saw your reel.
I want round.
Yeah.
Wow.
Me too.
I saw your reel, and you had it, and the two going through the staff, and they were like all asking and stuff. It's just
so
like
good. So good.
It's there because it's definitely on my feed. It's definitely on my feed.
I feel like the world, and you live in the world of fillers and toxins, has been like that's like innovating all the time, right? And then like breast implants have been like wah wah wah.
Yeah.
And now we're like, whoop.
Yeah.
We're back in it, you know, and it's awesome. It's awesome.
It's good.
It's competitive. Let's get some competition
Yes.
going in the breast implant world. I love that. Well, thank you so much, Dr. Gear, for joining us today. I love all of this stuff.
Yes.
This is so fun. And don't forget, like, subscribe, follow, do all of the things.
Subscribe below.
Underneath. And make sure you're listening. We're on all the podcast platforms and all that jazz. I've been listening on Spotify.
Yeah.
But remember to always stay curious. Always stay informed, and always remember to consult before you cut. We'll see you guys next week.
Thanks, guys.